We're asking ourselves, how can we harness the power of technology to get the best healthcare and outcomes for our people? Because we know technology, it never stands still. The progress that we're making for First Nations should also never stand still.
Welcome to First Nations Health, a podcast dedicated to exploring the vital work of the First Nations Health and Social Secretariat in Manitoba. I'm Renata Meekons. Join us as we delve into the important topics of Manitoba First Nations health information, stories, insights, and expertise. From traditional healing practices to modern healthcare initiatives, we uncover the diverse landscape of Indigenous health, wellness, and healing. Tune in to empower yourself with knowledge, foster understanding, and champion health equity for all First Nations communities across Manitoba. Today, we're going to be talking about e-health in Manitoba First Nations and how the First Nations Health and Social Secretariat of Manitoba's e-health department and IT department support Manitoba First Nations. Greetings. We're here today with Jerilyn Huson, and she is the acting director with e-health at the First Nations Health and Social Secretariat of Manitoba. Welcome, Jerilyn.
Oh, thank you, Renata. Great to be here today.
So maybe we're going to be speaking about e-health today and all things e-health at FNISM, but I would like to start off by asking you to share a little bit about yourself.
Well, I have been with the organization for a while, so I'd say over 15 years-ish. Myself, I'm originally from Garden Hill First Nation on my mom's side and a little island of Trinidad on my dad's side. And I have my husband and 2 kids. So we also have close family ties to Gitxsan territory in the northwest interior of BC. And as you said, today I'm just here to talk about e-health.
Awesome. Thank you so much, Jerilyn. So moving on, we just want to share a little bit about e-health at First Nations Health and Social Secretariat. So Jerilyn, can we start off by learning a little bit more about what e-health is and its purpose?
For sure. So the purpose of us here in e-health is to reach First Nations people in Manitoba and to strengthen physical, mental, emotional, and spiritual health using health-related applications and technology. And basically, that's kind of like a fancy way of saying or asking ourselves, how can we harness the power of technology to get the best healthcare and outcomes for our people?
Thank you. When it comes to e-health, I think a lot of people don't know all the terminology, and technology isn't something that, we're all blessed with knowing about, and especially with connectivity. So there's lots of different moving parts when it comes to e-health. But just moving on to learn more about it, can you tell us a little bit about e-health governance?
Sure. Well, here at FNISM, we have a steering committee, a stewards circle. We call them e-Aniscopatak, and they were founded in 2016, and it was basically a mechanism to tie together all of the clusters of e-health. So all the ways that e-health is available in First Nations or could be used in First Nations, the e-Aniscopatak Stewards Circle is responsible for guiding our e-health department to bring all those things to fruition for First Nations.
And just a little bit more about the e-health department. Could you tell us a little bit about the team, what kind of team members you have? Sure.
We actually have a pretty robust team. So our department is just under, I think, 20 people, working in a variety of program areas and files, ranging from, community electronic medical records to IT to privacy, and even moving a little bit more into housing now with the housing knowledge base. Our department, like I said, we've got a really good, strong team. We're always growing and always have that growth mindset in mind, because we know technology, it never stands still. And so the progress that we're making for First Nations should also never stand still. Always thinking of the ways that we can use technology to advance things on the ground in First Nations.
On that, about the IT team as well, which is under e-health as well. I do know that they also do work in deployment as well, and we'll be talking about that a little bit later as well, right?
Right.
Okay, good. So just moving on to some of the programs and projects that you do. Could you tell us a little bit about the programs in e-health?
Sure. So overall, like I said, we We help to support First Nations in their use of the Mustimuk Community Electronic Medical Record. You'll hear us refer to the CEMR many times, and that's exactly what we're talking about. So it's like an electronic medical record that is designed specifically for use in First Nations health centers. So looking at, facilities that basically provide primary health care in more of a community health setting. Otherwise, we also have FIMS, which is just the acronym for our Public Health Information Management System. As you mentioned, we provide regional IT support. We also have a privacy officer file as well, so helping to support First Nations all across Manitoba with their privacy needs. And also the First Nations Housing Knowledge Base, which is basically a housing database to help support First Nations to be tracking their housing stock, and it's going to be like an online resource for all things housing.
I'm really excited about that.
Yes.
There's a lot of great information on the knowledge housing base that's already existing, and you can access it through the FNISM website as well, and just search the housing knowledge base, and you should be able to, it should come up.
That's right.
Yeah. So that's a really great source of information and resources for those who are working in the area of housing in First Nations communities, and it brings together all the resources that they want to share as well in there, hey?
Right. And so when we think of the work that we do in eHealth, being within this organization, FNISM, as a regional organization that works for all the First Nations in Manitoba, having these files, it gives us an opportunity to help support all the First Nations across the province that would like our support in any of these areas, whether it's privacy or CEMR or housing. So we always try to keep in mind the ways that we can really benefit from those economies of scale and support as many First Nations as possible.
And just moving on to another area that I wanted to ask you about as well is Jordan's Principle. It's very important in every community in Manitoba and across Canada. Could you tell us a little bit about the Jordan's Principle data management and reporting project?
Oh, for sure, Renata. So the data management and reporting project has us collaborating with some partners federally and at the community level as well. So the way that FNISM eHealth is able to support the project really is through our IT support. So communities more and more are realizing the benefit of using the Mustimuk CEMR for their Jordan's Principle charting. And, we've got a long relationship with Mustimuk, and deploying that software application to different First Nations across the province over the last 12 years. So it was like a natural, fit or progression or evolution to start using it for Jordan's Principle programs. Our support mainly is in the area of technical advice and also providing technical support services for any Jordan's Principle program in Manitoba that's interested in having us support them. So what I mean by technical advice and technical support services is that, to use a software program like the CEMR, obviously you need some good hardware to be able to do that. You need the internet connectivity to be able to, connect to the software and then have ongoing support for that. So we help communities on that respect, being able to connect to the software and have a secure and safe environment to do their charting.
And there's a number of First Nations communities across Manitoba that are engaged with Mustimuk as well, right?
Oh, yes, that's right. So right now, under the CEMR file, we are currently supporting 22 First Nations health centers to use the CEMR. So that's all the way from, expressing their first interest to getting them the hardware they need and collaborating with Mustimuk CEMR's team to onboard them. So 22 First Nations, I said, that we directly support, but across the province generally, there are actually 38 First Nations in total that use it. It's just that the 22 are the ones that we've actually deployed directly ourselves and provide the IT support to them for.
Great, thank you. And just talking about, this, it really makes me think about connectivity. And of course, we know that our communities are at different levels of connectivity, and that comes into play as well, right?
Oh, that's right. Yes. So in terms of our IT support and connecting communities to the CEMR and other supports, we've actually been using Starlink as a workaround, or communities have been engaging with Starlink as a workaround. So we are fortunately, once we are helping to support a community, we're able to go in and help to install their Starlink dish for them and then get them all connected to the CEMR.
Awesome. Thank you. So next I wanted to ask you about e-health applications presence in Manitoba. So we hear these terms, and maybe you could just describe them a little bit more, but wanted to talk about e-chart, telehealth, and e-consult. What are those? Could you tell us a little bit about them?
For sure. You know what? I feel like these are terms that we throw around so much because, in e-health, we are so familiar with them. We've got a good history with these applications. If you talk to somebody in a health center context, I think they recognize them, they use them. They are very well deployed throughout the province. So in terms of e-chart, I think I'll start there. So e-chart it's a provincial electronic health record that provides a view-only access for authorized healthcare providers. So what that means is that in a healthcare setting, you have people who are authorized to be able to view the information that's housed within the electronic health record and within somebody's personal health files. That's where healthcare providers could access like lab information, and just really everything that would sit in the patient's health file. We've seen some really good progress in deploying those applications to First Nations. So I'm really happy to announce, anytime I can say it, that telehealth is actually currently deployed at 58 First Nations. So that's 92% of the First Nations in Manitoba. I think that is so worthy of celebration. And then also e-chart we have deployed at 56 First Nations in Manitoba, or 89%. And I say we because Finiston does have a bit of support that we provide in there, but to note that those are provincial digital health applications. But, through our partnerships with Shared Health and Digital Shared Services, if we can play a role in that, we're always happy to support that.
That's really great news. I'm glad to know about that. Could you tell us a little bit about telehealth and e-consult?
Oh, sure. So telehealth is a secure video conferencing system that's used for patient care or health education or even health service administration and also televisitation. So that's a big important one. So when we talk about telehealth, the thing that we talk about is bringing your healthcare closer to home. So we know that in a lot of First Nations, patients are required to travel outside of their home communities to receive healthcare services. But deploying telehealth to different health centers in different First Nations, they're able to, like I said, bring that healthcare closer to home so they can actually see healthcare providers over the telehealth system. And eConsult is similar. It is also a web-based app, and it allows primary healthcare providers to consult with specialists so they can get advice, recommendations, or diagnoses about non-urgent health-related conditions.
Okay, so I have a question related to these. Would example of maybe peer support groups like AA be a part of these maybe telehealth?
Oh, absolutely. So I think it was over COVID that we saw a little bit of a break in that, but there is a history of AA programs using telehealth services to meet and host their groups over that. It has a good potential to expand, and people are seeing the benefits of it and, being creative in the way that they're using it.
Thank you so much, Cher. So I am just going to move on. I wanted to learn a little bit more about IT support. Now, the First Nations Health and Social Secretariat has IT support, of course, for its organization, but it extends to communities, connected to health. Could you tell us a little bit more about that?
For sure. So IT support is one area that I'm super proud of to be part of eHealth. Our IT support, they really specialize in providing tailored IT solutions for Manitoba First Nations health centers. And like I said, now it extends also to Jordan's principal programs and, for any interested First Nations. So what they do is to deploy and support their IT infrastructure and also digital health applications, which includes like installation and maintenance of hardware, networking equipment, backups, and cybersecurity. So it really is a whole wraparound IT support for First Nations, in addition to supporting our office here at Finisum.
Just on that note, I think about like when communities are preparing, maybe they're having renovations in their health center or they're getting a new health center. It's really important to think about the IT needs as well when it comes to their new buildings. Hey.
Oh, absolutely. And we have actually helped to support some health centers on that front as well. So it's really helpful and useful to have that advice up front. That way, when you have any, like say, networking or cabling considerations, you've got some good expert advice coming your way.
Awesome. So if your health center needs IT support, you can get in touch with the FNISM IT service desk. You could reach them at servicedesk@FNHSSM, or you can contact the FNISM IT service desk at toll-free 1-855-455-5358.
That's right. And we are always looking to expand our IT team in any ways that we can so that we can continue to support any interested First Nations.
Thanks, Jer. So moving on, we're going to talk about the privacy office. Now, when it comes to e-health, information technology, it is important to have protocols in place for privacy. And I'm just wanting you to elaborate a little bit more about the privacy office and what that entails.
Sure. So as I mentioned, with FNISM being perfectly positioned to provide the regional support, that is actually the goal of our privacy office, is to provide that regional coordinated support to First Nations to help enhance, develop, and implement their own local privacy and health management systems. So in terms of our regional coordinated support for the privacy office, that's also included doing a bit of a scan of the First Nations across Manitoba. We were actually able to come up with some pretty significant important findings and have learned that about 2/3 or 65% of First Nations had privacy and information security policies and procedures. To me, that's a huge win. Although we also did find that the same number, 65%, actually did not have a privacy officer. So might be a little bit of a gap there, and that would be one of the things that FNISM eHealth would be looking at, seeing how we can support First Nations in that front. And then another key finding that we had was that 65%, again, this key number that keeps coming up, were interested in training in OCAP.
And OCAP would be in relation to in making sure the protocols of First Nations owned and led data that we're looking at there, right?
Yes, that's right. So in First Nations, and all over the place, we all recognize how important privacy is, and the landscape is always changing with the changes in technology, the always continual advancements. So to hear that First Nations are keeping on top of that and always interested in training, we see an opportunity to support First Nations in that front, making sure they have access to that training, whether it's, online in their own offices or, through our office. We just appreciate being able to provide that support.
And just on that note, Jerilyn, about OCAP principles and the training, where does that happen? Does that happen in Manitoba? Is it online?
I believe there is an online training. Honestly, I would defer you to our research department. They seem to be leading that here. So I would keep in touch with them on that.
Yes, and we are going to speak much more about research when on another podcast when we get to talk to them.
Awesome, because anytime you're talking technology, medical charting, privacy comes into play, OCAP comes into play, and you really want to be on top of data sovereignty, which our research team is. So good expertise, good resource there.
Mm-hmm. And just for a visual for many of us don't see the insides of buildings, but when it comes to data and keeping that safe, we're looking at, having the infrastructure in place in buildings to make sure that it's in a safe, secure location. And maybe that might be off-site, it may be on-site. So when it comes to security and data protection, there's a lot of different considerations, and that includes physical infrastructure as well.
That's true. And so that is another area where I always have to applaud our IT team, because they do stay on top of OCAP training and also cybersecurity practices. So when we are providing any sort of advice or guidance or, direct IT support to communities, they are very well positioned to speak to that and to provide that advice and guidance.
Great. Thank you, Jerilyn. So we are nearing towards the end of our podcast, but I did want to speak a little bit more about the First Nations Housing Knowledge Base. Now, the First Nations Housing Knowledge Base is within the eHealth department, and there is a level of technology in it because it is online. But I just wanted to talk about that a little bit more and hear from you a little bit more about, what it is and how it came to be.
Oh, for sure. So I can understand how you might think that there is a bit of a disconnect between e-health and housing, but the way that we're supporting this is with, like you said, the First Nations Housing Knowledge Base, and that is a database. But we tried to put it in a language that was a little more aligned with, First Nations thinking and ways of doing things. So this online database is basically, it's just designed for Manitoba First Nations communities. It's an online platform that will offer housing managers, directors, and community members crucial resources on housing supply, community development, and tenant support.
That's great. And this can be found, as I mentioned earlier, on our website. So if you just search the First Nations Housing Knowledge Base, you can find it on there. And so this is just established this past year, correct?
That's right. Yes. So we are in the third year of a 3-year project. Over this past year was when we really were able to get it online and populate so much of the content for it.
And if you are interested in going on there, you can sign up to be able to get updates as well in the future. I believe that we're going to be having housing related job postings as well. So lots of different housing related information on there. It's really, really valuable. I've had a chance to go on it.
Awesome. Great to hear. I'm really excited to see how it's going to be used by housing professionals in First Nations. We have a great team working on that as well.
Great. So, Jerilyn, I would like to thank you very much for sharing information about eHealth today and all things that Finism does in the area of eHealth and IT. But I just wanted to ask you, was there anything else that we missed that we need to share with our listeners?
Well, Renata, I just need to say thank you very much. I super appreciate you providing this opportunity for me to come out and talk about eHealth today. I would say just to invite all of our listeners to come and check out our eHealth department newsletter. It's a quarterly newsletter that we put out in alignment with the change of seasons. So when you know summer is coming, you know the eHealth newsletter is coming.
What are some of the topics in the newsletter, Chair?
Well, of course, we always want to provide our readers with updates on current initiatives in our eHealth department, as well as letting them know where we plan on going in the future. And on top of that, sometimes you'll find some editorial pieces on different areas related to eHealth, whether it's privacy or there was one article that talked about internet connectivity as a social determinant of health. That was a very good one. So lots of informative pieces in there, and it actually comes out quarterly.
Okay, yeah, that sounds good. And I do know also that there is opportunities as well that are shared in there. And one of them that Finism shares often on social media is with ComIT. And ComIT is a partner organization that they occasionally send us information about free training opportunities in relation to IT. So we sometimes include those in our newsletter as well.
Right. If we receive it in a timely way, sometimes it doesn't always time out with the timing of our newsletters, but we do actually put out calls for submissions, to our partner organizations. If they do have anything to share in there, you'll find that we'll be updating. If there is a new eChart site in the province, we'll always put the update in there to let everybody know the success in adding a new eChart site to the province. That's great.
And so to find this e-newsletter, we could find that on the Finism website, and you could just search FNHSSM eHealth newsletter. It should come up. And you could find that on our website at finism.com, FNHSSM.com. So that's where you can find the newsletter. And you can also find it on our social media, where we pretty much highlight it. Whenever it comes out, we do our best to highlight it and get it out there as well. So you can find it there as well.
Yes, thank you, Renata. I see that you were equally as proud of the newsletter as I am.
I am. I love newsletters, so I look forward to them. So with that, we'd like to close off, and I'd like to say again, thank you very much, Jerilyn, for your time today. And we hope that you enjoy learning about eHealth today, and we welcome you back to our next podcast coming up soon.